I'm Jennifer Reyes and I'm going to be doing the CVC dressing change. We're going to come into the room and identify our patient, perform hand hygiene, and put on gloves, and then we will begin our assessment of the actual area after taking our vital signs. We're going to let the patient know that they need to be laying down flat and to turn their head the other way so as to minimize the risk of infection. We're going to assess our actual site, making sure all axes are clamped. And we're going to check for any crepitus, any drainage, swelling, infiltration. We're going to make sure that the patient hasn't reported any pain or any changes at the area. At this point, we'll take our alcohol wipes and begin the removal of the dressing. We're going to use the alcohol wipes to help remove the tegaderm. And once we get it to the center, we will leave it attached at the center. We're gonna have our sterile gauze by the bedside, and we're gonna go ahead and open it and grab it from the edge. As we remove our dressing, put it in our biohazard bag, and then just go ahead and place it on the site. At this point, we can go ahead and set up our sterile field. We'll clean up our area very quickly. We'll make sure that the table is sanitized, remove our gloves, and perform hand hygiene again. Once we're ready to start, we're gonna make sure that we have our bio patches at the bedside. So we're gonna have our bio patches and our little tray to perform the removal and the dressing change. We're going to check for integrity and remove the top as we set up our sterile field. We're going to set our drape with the shiny side down. And we're going to put on our gloves. We're going to ensure that we have enough space in our area. And we're going to go ahead and put on our gloves. This, we're gonna get rid of our glove paper, and we're gonna go ahead and begin placing our items onto our sterile field. We're gonna get our iodine, our alcohol swabs. We're gonna have new dressings in there, as well as a new 2x2. And with our measuring tape, we're gonna get it and just go ahead and fold it at the 0 centimeters just to ensure that we're ready to measure the hub once we're done. And then we're gonna gently place it there. Since this gauze was sterile, we're gonna go ahead and take it from the side, right from the middle, and then we will place it in our biohazard bag. First, we're going to begin by cleaning with our alcohol. And then we're going to clean from the center outward, making sure not to repeat any areas, so it can be a wide area. We're going to do that for each swab. And we're going to be assessing if the patient has any pain or discomfort. So we can go ahead and throw that in there. After that, we're gonna go ahead and cleanse once more, but with the iodine packaging, and we're gonna make sure once again that the patient doesn't have any allergies to iodine. And we're just gonna repeat the cleaning process all around in a circular motion without repeating any spots. After that is clean, we're gonna allow it to dry. And then we're gonna go ahead and measure from our port, from our entrance to our hub. And we are gonna record that measurement in our documentation to make sure that the port hasn't migrated or maybe it hasn't been secured correctly. After that, we're gonna grab our bio patch, which should be in our sterile field. We're gonna go ahead and put it We're gonna grab our new Tegaderm. And then we will secure it, making sure everything's nice and tight. Once we secure it, we're gonna make our label with our initials, date and time. And after that, we're gonna go ahead and document how our assessment and our reassessment of the patient once we're done. We're also gonna write down the measurements for the hub and the first patch. We're gonna coca it, so we're also gonna record that. We're gonna reassess how the patient is feeling and their vital signs once again. And we're just gonna make sure that it's secure and ready for the patient to continue their treatment. And that's it for the dressing change.